Now, my dear friend, we go ahead. Certain exercises helping lot to increase the flexibility, and we have the non-surgical vaginal tightening hypo. You can use this. This is a particularly 360 rotation here. This give the some high frequency ultrasound rays, and that give the tightening the inner vaginal lining of the female partner. And now just legit model I completed. Just we go. Just most of the new doctors are joining, so that's why I selected first half hour or 1 hour. I will give the just instant tour on syllabus. According to psychosexual development, Sigmund Freud is a great psychologist. He said, whenever there is a problem about the after the baby birth of baby, oral stage 0 to 1 year, pleasure from eating and vocalizing, when the baby start sucking the breast and taking the food, he enjoyed the same things will be get the enjoyment in the later their life. If something happened wrong here, they may have some wrong. Anal stage, like a phallic stage, touching, and latency, identification with same sex parent, and genital is heterosexual attraction, 12 to 18-year age. These are the age group, these are things. And if something is for developmental, baby developmental problem in such type of stages may hamper their future sex life. But there is no as such why they are heterosexual and by why they are homosexuals. But homosexuals, according to them, they become a bisexual most of the time if there is such type of developmental problem, and there is no biological research and diagnosis so far any hormone, because everything is normal. Testosterone is normal in male, but they are homo. Organs are normal, still they are homo. They are transgender. Sometimes transgender is just terminology where male, but his mind is female. That is a transgender. Means chakka, जो भी आप बोलते हैं chakka particularly. These are the female having a, because there are 20% in each and every community having such a problem. 80% are heterosexual, normal. 20% you have to find out whether your patient is falling in this 20% or not. Gender identification is very, very important factor for the treatment of your patient. What psychologist says that we will take in our future slides when today's program of libido. I'm not taking your much time here. Just erotic zone stimulations. You have to write down what type of erotic zone stimulations, because I told you kidney and urinary bladder stimulation helps a lot, and in the same way ears represent whole body of the and the person. Particularly, you just having a slight bite to the ear can stimulate their erection in a male partner as well female orgasm. Female erogenous zone is nothing like a female or male, is the same. Both ear is one of the part stimulation. Just I'm giving you broad sense understanding. You have to develop your own. You have to see, because innovative ideas you have to apply. That is, you can say, evidence-based treatment or management in sexual medicine. LM potency I am using much more in my, though LM potency is nothing but 1 into 50,000 dilution of certain remedies in the homeopathy. There are a number of software available, easiest way how to approach that medicine, and I have found number of cases after 2 or 3 months treatment, they are okay for years together. Why not such type of treatment you should adopt in your practice? Those are allopathy, they can use it not in the name of homeopath, but name of LM potency. You say is a, and give the understanding to your patient. This is based in homeopathic dilution and had very good results. You should know that we will teach you in a 3 days training program. If you are interested, you ask me, sir, how you approach for this. I can take your 20-30 minutes on aspect, because now there is no spoon feeding. Now the learning is from your heart. We want learning from inside out, not something is putting for this, because you have to learn your unique personality. Why the few people are rich and 20% people are rich or 80% are poor? Because we never think in that way. So that things you have to add here and understand the things. LM potency can be given with the homeopathy, can be given with the allopathy also as well. I am giving it at my center. 7 reasons why should, okay fine, I am not taking, this is a very important factor. Biomix is available, Quadramix available injectable. Papaverine injection. Suppose everything is fair. Mostly elderly, you consider these things in elderly patient. And for 2-3 injections or up to suppose once in a month injection, no fibrosis problem. But if the patient is using very frequently, then there may be fibrotic sticks develop in this intracavernousal. It means a penile shaft. You have to prick the injection. Where to prick this injection? What is contained papaverine with prostaglandin, with phentoline, all these things we will send you all my this slides and this pleasure. You those are newly joined, please ask, give their email address, and if suppose it's some delay in posting, ask us to just sir delay, please give us, so we will send you immediately. We ask my assistant, she will send everything. If sometimes some work she may forget, just ask me, I will send you. Where to inject papaverine? Always think titration of dose of papaverine is very, very important. Simple way, there is 40 units. Suppose this one ampoule, this is a 80, 40 to 80, but you have to give 20, maximum 40, not more. So divide this one ampoule into 4 ampoule, 4 syringes of papaverine. Most of the time patient want old age, they want erection immediately. After giving the papaverine injection, you just give the injection at your OPD basis and tell them, take some consent letter first prior to this, very, very important. Sometimes patient or your dose is excess, the patient may have problem. That is called priapism. It's very common. Then there is decompression operation and urologist role and prosthesis role, penile prosthesis role start. So it is a heavy burden or tax to your patient. Don't give the tax to the patient. We are here for giving benefit to the patient, not creating problem to the patient. That always keep in your mind. Which position you should inject? See, this injection, if you keep the penis like this, there is the glans penis upside. You know the glans penis, just take the skin, you see the glans penis up. Then here is around 10 o'clock, here is about 2 o'clock. If watch is there, round watch, and see that position you have to prick this injection. Immediately after 3 and observing at your OPD, 3 to 5 minutes, get the erection. Ask him to remain in my OPD for 1 hour and get asked to drink more water and pass the urine so that it become a flaccid. If not, ask them to have an intercourse and then get the flaccid. Flaccid is very important things. Otherwise, you have to inject wherever you are injected. You have to put the scalp vein and remove the around 100 to 200 cc blood. But this should be done under urologist most of the time, because nowadays, medical legal problems. Give give the treatment. In such cases, they have more faith on you, and you can understand that patient can not go against you. If something, or tell them, if 1 hour is not happened, you will come back. Before 3 hours, he must reach at your clinic, so that you can remove and you can flacid the penile shaft. Very important things. Remember. Uh, this is a procedure for injection papaverine. Okay, we go ahead. Procedure therapy for infertility. Just 1 minute. Give me 1.